Of the COVID-19 infection in Tunisia, the country's prime minister has urged stakeholders in the public and private sector to import more oxygen cylinders from other countries to avoid further shortages. Tunisia commended Algerian authorities for allowing them to import oxygens that helped in saving many lives during this demanding period of the pandemic. The North African country has initiated a response committee to monitor and assess the availability of medical equipment in different health centers. And let's have more details of that in this report.
The Prime Ministry has urged stakeholders in the public and private sectors to find solutions to import oxygen cylinders from neighboring countries.
It's unacceptable that we are surprised by the shortage of the medical oxygen. We've been warning for 2 weeks against the spread of the pandemic and the surge in cases. Consequently, hospitals need more oxygen cylinders. Today, all parties involved must provide oxygen by importing cylinders by air and sea freight.
The government of Hisham Shishi extended thanks to Algerian authorities for providing Tunisia with large quantities of oxygen.
The number of patients is on the rise. The national need for oxygen increased suddenly. So we've informed the Algerian authorities, and Algeria has allowed us exceptionally to import oxygen cylinders. We thank Algeria for this solidarity, which has saved lives during this difficult period.
Tunisian and Algerian civil society organizations have donated 2,000 personal oxygen rescue kits.
We launched a pilot project and distributed 6,000 personal oxygen rescue kits in Algeria. The operation was successful. That's why we are now operating in Tunisia to help combat the pandemic.
Tunisia's government has created an advisory committee to assess the pandemic response. The committee will be responsible for monitoring efforts to strengthen the capacity of hospitals as well as the availability of medical oxygen and medical equipment. Prime Minister Hisham Shishi has announced that all means will be made available to the health department to avoid shortage of oxygen as COVID-19 cases surge in Tunisia. The Strategic Health Operations Center will monitor oxygen supply operations.